Do you ever feel numbness or weakness in your hands, trouble with balance, difficulty in buttoning your shirts or holding small objects? Many people ignore these early warning signs thinking it's just aging or a temporary issue. But what if I told you these could be symptoms of a serious, sinister spinal condition called cervical myelopathy? If left untreated, this can lead to permanent nerve damage, loss of mobility and even gradual paralysis. Today, I'll explain everything you need to know about cervical myelopathy. What's the cause? How to recognize the symptoms, treatment options, and how you can prevent it from getting worse. Hi, I'm Dr. Arvind Kulkarni. I'm a consultant spine surgeon at Mumbai Spine Scoliosis and Disc Replacement Center, and we operate at Breach Candy, Bombay, Saifi, and HN Reliance hospitals. Over the years, I've treated thousands of patients suffering from spinal disorders, and one of the most common conditions which is misunderstood is cervical myelopathy. Many patients delay treatment because the symptoms start gradually, but ignoring it can lead to serious lifelong consequences. Let's dive deep into understanding this condition and how it can be treated effectively. What is cervical myelopathy? Cervical myelopathy is a condition where the spinal cord in the neck, that is the cervical spine, becomes compressed, leading to progressive nerve damage. The spinal cord is like the body's control center, carries signals between the brain and the rest of the body. When that's compressed, it can cause widespread neurological symptoms affecting movement, sensation, coordination, bladder ball function, etc. If not treated, it can worsen over a period of time and cause permanent disability. Cervical myelopathy is caused by anything that puts pressure on the spinal cord. The most common causes are degenerative changes, that is cervical spondylosis related. As we age, the spinal discs wear out, leading to formation of bony spurs, disc bulges, thickening of ligaments, altogether pressing on the spinal cord. This is the most common cause of cervical myelopathy and usually seen in elderly patients. Herniated discs can cause cervical myelopathy. A bulging disc can press upon the spinal cord and cause acute inflammation and nerve damage. Any kind of trauma or injury to the spinal cord can cause cervical myelopathy. This time it is acute. Even tumors or infections can cause compression of the spinal cord and lead to myelopathy. What are the symptoms of myelopathy? They develop gradually and worsen over a period of time. Early detection is crucial to prevent irreversible damage. Common symptoms include loss of hand dexterity, making it difficult to button shirts, use keys, hold small objects, difficulty in signing your check, weakness or numbness in the hands and arms, sometimes extending to the legs, difficulty in walking, balance issues leading to frequent falls, neck pain or stiffness, though some patients may not experience significant discomfort. Bladder and bowel symptoms in advanced cases, including loss of control or urination or bowel movements. How do you diagnose this condition? If you experience any of these symptoms, don't ignore them. Early diagnosis can prevent permanent nerve damage. Diagnostic tests include clinical examination to check reflexes, muscle strength, coordination, MRI scan, which is most important and accurate test to detect spinal cord compression, X-rays to check for bony spurs, arthritis, alignment of the spine, and in cases where the patient has contraindication for MRI, CT myelogram is necessary. What are the treatment options? Treatment depends on how severe the compression is and how much it is affecting your lifestyle. Non-surgical treatment hardly has a role, but in initial cases may consist of medications such as pain relievers and anti-inflammatory drugs to help with mild discomfort, physical therapy to strengthen muscles and improve posture, though it will not stop the progression of the spinal cord compression. Cervical collar or neck brace may provide temporary relief, but it does not fix the underlying problem. It is important to note that if myelopathy is moderate to severe, non-surgical treatments will not reverse the damage. Surgery is the only option to stop it from worsening. If myelopathy is causing significant nerve damage, surgery is recommended to decompress the spinal cord and prevent further deterioration. The common surgical procedures done for this particular condition are ACDF. The damaged disc is removed from the front of the neck and replaced with a bone graft and plate and screws, fusing the vertebrae for stability. Cervical disc replacement in certain cases, or posterior, that is surgery from the back. If multiple levels are involved, the surgery is done from the back of the neck to create more space for the spinal cord. How do these surgeries fare? High success rate with many patients experiencing immediate relief of symptoms. Surgery also helps in preventing further nerve damage, which is key to avoid permanent disability. Early surgery leads to better results as prolonged compression makes it harder to regain full function. Most patients recover well within a few months. Here's what to expect. Hospital stay usually lasts for 1 to 3 days depending on the procedure. Pain management will be provided, but discomfort usually mild and temporary. Physical therapy is recommended after a few weeks to regain strength and mobility in arms and legs and get your coordination back. Return to work is within 3 to 6 weeks for desk jobs, while physically demanding jobs may take a few months. All in all, cervical myelopathy is one of the most serious spinal conditions because it progresses silently if left untreated. But the good news is that early diagnosis and timely treatment can prevent long-term disability. If you or your loved one is experiencing symptoms of myelopathy, please do not wait. Consult a spine specialist immediately. I'll be sharing more insights on spine health, treatments and recovery tips. So make sure to subscribe to the channel and share this video with anyone who might need it. Your spine health matters. Take action today. See you in next video.